Thank you. These are our disclosures. Genitourinary syndrome of menopause, previously known as vulvovaginal atrophy, can have a significant impact on a woman's sexual health and quality of life. Treatment modalities include non-hormonal and hormonal options. The use of fractional CO2 laser has emerged as a non-hormonal treatment option for the management of GSM. Although the number and quality of vaginal laser studies are increasing, data is still limited. Furthermore, assessment of symptom improvement traditionally has relied on limited measures that may not reflect the broad impact of symptoms on sexual health, day-to-day functioning, and well-being. Thus, the aim of our study was to describe patients' perceptions on GSM and treatment experience following fractional CO2 vaginal laser treatment for genitourinary syndrome of menopause. Our study was a mixed method study which combined a case series with a prospective qualitative component. Women who underwent at least 3 sessions of fractional CO2 vaginal laser between 2015 and 2018 were identified by their procedural codes. The electronic medical records were queried for patient demographics and peri-procedural data. Semi-structured interviews were conducted to address patients' perception of GSM and to prospectively gather data on long-term outcomes, including patient experience, sexual function, and satisfaction following fractional CO2 vaginal laser. Additionally, patient surveys were utilized to administer validated questionnaires to address sexual function and assessment of symptom improvement. Qualitative analyses was performed using a grounded theory approach. During the study period, 50 patients underwent greater or equal to 3 vaginal laser sessions, at least 6 weeks apart, and 24 patients agreed to participate in the study. This table shows the pre-procedure characteristics for all patients. The majority of the patients were white, never smokers, married, and sexually active. The most common etiology of menopause was physiologic, followed by iatrogenic and pharmacologic. 38% of the participants had a history of breast cancer. Of these, 2 patients underwent an anti-estrogen hormone therapy while on laser treatments. At baseline, all patients reported more than one vulvovaginal symptom. The most predominant symptom was dyspareunia, found in 92% of participants, followed by vulvovaginal dryness, itching, burning, and dysuria. This table shows pre-procedure, concurrent, and post-procedure treatment modalities used by patients. During vaginal laser treatments, 54% of participants used concurrent lubricants and/or moisturizers, while 33% used concurrent vaginal estrogen. Following vaginal laser treatment, patient-reported events included vaginal discharge, vaginal itching, and light vaginal bleeding. No patients reported heavy bleeding, vaginal burns, scarring, or de novo dyspareunia. For the qualitative analyses, 24 interviews were conducted. The median time from last laser treatment to interview and survey was 17 months. Three major themes were identified from the interview narratives. Patients were surprised by the nature, extent, and severity of their symptoms. Expectations and goals of treatment varied significantly among participants. Patients viewed and described treatment success in very different ways. And there was variable access to treatment, owing to a lack of information among patients and providers. The following subthemes were identified. Non-sex related symptoms greatly affected everyday functioning. Treatment response is diverse and heterogeneous. Following the first and second laser treatments, many women were disappointed or felt a sense of helplessness. Overall improvement was noticed after the third treatment, and multimodal treatment affected patients' perception of satisfaction. This table shows the individual domain and global scores of the Female Sexual Function Index questionnaire. According to this validated tool, 53% of participants met criteria for sexual dysfunction at the time of interview. Respondents most commonly experience sexual dysfunction attributable to the domains of desire, lubrication, and pain. 67% of participants had attempted intercourse during the previous 4 weeks. Of these, 33% of patients experienced pain with intercourse most times, and 25% a few times. 42% of participants rated their pain during intercourse as low, and only 8% reported a high or very high degree of pain during intercourse. At the time of interview and prospective survey, 74% of patients reported improvement in vaginal dryness, while 26% reported no change. Also, 73% of participants reported improvement of dyspareunia, while 9% reported worsening pain. Regarding satisfaction, 63% of patients reported being satisfied with their treatment, 13% reported some degree of neutrality, and 25% were dissatisfied. However, 83% of patients would choose to have vaginal laser again to treat their symptoms. In conclusion, GSM symptoms have a significant impact in patients' sexual health and everyday functioning. The majority of women who undergo vaginal laser report satisfaction and improvement of their symptoms. Treatment satisfaction persisted despite variable long-term effects on sexual function, which is why GSM remains a complex medical condition with significant heterogeneity in symptoms as well as treatment response. Thank you.